Clinical care of paramedics keeps increasing. The demand on healthcare keeps increasing for paramedics in the community.
Our organisation has been growing for many, many years now, as has the amount of work that we do, particularly in metropolitan Sydney.
Traditionally, paramedics would go out of a 80-year-old ambulance station. The infrastructure really did not meet the current needs.
They were no longer fit for purpose. They were at capacity, and many of them were not in a reasonable condition.
Speaking from the station I came from, it was old. It was bulging at the seams with staff. We would order our own stores, put our stores away, clean our cars, restock our cars. In general, there needs to be a change.
In 2010, we were lucky enough to receive an investment in our infrastructure, and what it delivered in a partnership with Health Infrastructure was 11 superstations and a number of paramedic response points that would complement our overall station footprint. There was a significant amount of redesign required, not only from a physical infrastructure point of view, but operationally, and that's, I guess, where the Paramedic Response Network program was born. The program ended up with around 11 projects in total, and they spanned from everything from data analytics, fleet and logistics, our operational model, our management model, and of course the Make Ready model, which has completely revolutionised the way that we prepare our fleet and resources in Metro.
The Make Ready model is providing all those support activities for a paramedic to treat patients in the community. We've treated the ambulance the same as a plane coming into the terminal at an airport. How does the engineering happen? How does the cleaning happen? How does the support service happen to get that plane turned around and back out servicing customers? It's no dissimilar to the ambulance. All the consumable items we use on patients need to be in date. There's over 1,400 individual items in the back of an ambulance that need to be in date that potentially could be used on a patient. We look at the environmental cleaning. How important is that to get right in the back of the car for the patient, particularly between patients and the paramedic's work environment?
Make Ready is actually really simple, and at its heart, it's about having the right people with the right skills doing the right job.
HealthShare was brought on to develop the model, and with their expertise, they developed it with ambulance to where we are today.
HealthShare is the shared service provider for New South Wales Health. We do all of the non-clinical support services, so everything from food and linen in the hospitals through to payroll, finance, and also procurement. It's designed to really help clinicians in what they do. We brought to the table some of our expertise around cleaning services and stock management, and now we've formed a really powerful partnership where we work together to really ensure that paramedics are well positioned and supported in terms of delivering their care.
So an ambulance will come in from the beginning or the end of their shift. We'll communicate with the paramedics of whether there was any issues with the vehicle, anything that needs to be restocked. There's a check sheet in the vehicle that we look at ourselves to get an idea of what we need to restock. We then clean bins, empty the rubbish, wipe down the vehicles, give it a clean on the outside of the vehicle, and then park it up for the next shift.
We've often described it as a valet service. I think our staff would agree that that's what it feels like.
I think the great thing with Make Ready is that they have a checklist. It tends to take the human error out of it. Once they've ticked it and signed it off and sealed it up with the zip tie, you can trust that it's there.
The kits are checked. Everything that's in that car is in date. From a patient perspective, it certainly enhanced the safety of outcomes.
I definitely think the level of cleanliness has improved in vehicles, purely because it gets done every single shift.
For them to be able to not only do a regular clean every shift, they do a deep clean.
The deep cleans are every 3 months. Start from scratch, take everything out of the cars, strip it down to bare bones to make sure that there is no underlying bacteria left in the cars or anything like that. Make sure that the ambulance is organised, everything's where it should be and easily accessible for the paramedics.
You get in them and you know they're clean, you know they're sterile, and like I said before, that is great for us, but it's also for the safety of the patient. Being able to focus more on the clinical side of things has meant that we can spend more time debriefing on jobs and talking and not having to worry about cleaning and the restocking. Like, we're getting out there and using our clinical skills and helping people. Having that team working behind the scenes to support us has been phenomenal.
It is a scalable model. The team are identifying lots of opportunities to implement components of Make Ready in regional and even remote areas. Our end game here is to improve the quality of the care that we provide to patients, and Make Ready is critical in doing that, particularly in relation to environmental cleaning. And so there is absolutely no doubt that there's a much broader application across the whole state.